The key topic I want to talk about today is the first one is what are the SIBO treatments that work? And I specifically wanted to discuss this because recently I found out that some practitioners think that what we have to treat SIBO doesn't work. This actually came up from a friend and a colleague of mine who we had a conversation, and it was really gave a lot of inspiration for this and some of the other trainings I've been doing for the practitioners. I was very taken aback to hear that there are SIBO practitioners out there that think that the SIBO treatments we have don't work. And in this conversation, I was able to clarify with this colleague, he's very active in the online gut health world, that that the practitioners that are saying this don't actually use the treatments that I use. And specifically, they use different herbal treatments. So I actually know that the treatments that I use, I have full confidence that the treatments that I use work. And so I want to just explain to you how I know that they work. And here's the picture of me and Dr. Shivan Sarna. So continuing my story from earlier, after I joined forces with Dr. Shivan Sarna, we started the first ever SIBO specialty clinic at the medical university where I teach in Portland, NUNM. And for those of you who don't know, I teach Advanced Gastroenterology, and I've been teaching that since 2013 at this medical university, along with Dr. Sandberg Lewis. And so this is us when we first opened our SIBO specialty clinic. We opened that clinic in 2014. It was the first ever that just was a clinic focusing on SIBO. And I was the medical director there for all the years that I was there. And we had other doctors who were working with us in the SIBO clinic and in the community. And what we did was at the clinic, we ran before and after SIBO breath tests for every treatment that we gave. So we had lots of feedback and data to show us what treatments worked and what treatments didn't work for the different gases and the different SIBO types. We also created herbal antibiotic SIBO protocols because there wasn't anything. We needed to figure it out. So what we did was we consulted with all sorts of experts and professionals to figure out what we were going to do. And one of the key people we consulted was Stephen Bruner. I don't know how many of you know him, but he's a fairly famous medical herbalist who wrote the book Herbal Antibiotics. And Stephen actually knew him quite well. So we consulted with him back in like 2010. And we consulted several other experts also. And that's how we initially chose which herbs and what doses to begin using. And we then refined those protocols and doses over many years with our patients and our before and after testing, as we saw what worked and what worked better. And we also used pharmaceutical antibiotics and elemental diet. These are the two of the other. We have 3 antimicrobial SIBO treatment types. And so we used all 3 of these treatment types equally with before and after testing after every treatment that we gave. We also met as a team every week for years to share our learnings with each other and go over what we were seeing. And this gave us the benefit of each other's, all the other doctors' experiences and their patient populations, and it exponentially increased our experience and learning and my experience and learning because we had so much more data. So that is the reason that I know that the treatments that I use work. It's not based on me, on my ego or me just thinking that they do. It's not actually personal. It's because I have data. I have extensive data of before and after testing, as well as symptom tracking of thousands of treatments given to SIBO patients. And all of us together, I was telling this story the other day in the patient webinar, and Shivan was pointing out how many, it's thousands, because we had a whole group of us, all we saw was SIBO, and this was over many, many years. So really thousands of before and after tests. And I do want to just say that after I share the specific treatments that we developed and that we used, I have some important points in case you are someone who already knows about all these treatments and already uses these exact treatments and still think that they're not effective enough. I have some caveats for you. So that is how I know the treatments I'm going to share work.